Namaskar. I'm Harpreet Kaur and I welcome you all to our live and interactive 5-day online course for regular teachers on including children with hearing impairment in the mainstream school education. Well, we keep on listening such things that children with hearing impairment should study with other children who can hear, and they should be included in the mainstream when it comes to education specifically. But how is it possible, and what all we do need to take care of? This is something that we are going to learn during this entire journey of our 5-day online training program. This course is specially designed for teachers, teacher educators. We also have with us inclusive education coordinators, school administrators and pre-service teachers. You are watching us live on PM eVidya channels 1 to 12, on PM eVidya ISL channel number 31 and on our YouTube handles NCERT official and NCERT events. जी हाँ, बहुत इंपॉर्टेंट ये ट्रेनिंग प्रोग्राम है जिसमें आप भी पार्टिसिपेट कर सकते हैं. एज यू ऑल नो दैट दिस इज़ समथिंग दैट वी आर प्रेजेंटिंग टू यू बिकॉज वी आर सेलिब्रेटिंग दिस वीक इंटरनेशनल डे ऑफ साइन लैंग्वेज, जो कि 23 सितंबर को सेलिब्रेट किया जाता है हर साल. और इस साल की जो थीम है वो भी बहुत इम्पॉर्टेंट है. दिस इज़ नो ह्यूमन राइट्स विदाउट साइन लैंग्वेज राइट्स. तो इसी के कॉन्टेक्स्ट में हमारा ये ट्रेनिंग प्रोग्राम है विच इज़ ऑर्गेनाइज्ड बाय सेंट्रल इंस्टीट्यूट ऑफ एजुकेशनल टेक्नोलॉजी, दैट इज CIET NCERT, in collaboration with I-XII, that is All India Institute of Speech and Hearing, Mysore, Karnataka. ये एक ट्रेनिंग प्रोग्राम है तो जाहिर सी बात है इसमें एक असेसमेंट भी होगा जिसमें आप पार्टिसिपेट कर सकते हैं, और अगर आप उसे सक्सेसफुली अटेम्प्ट करके 70% से ज़्यादा मार्क्स स्कोर करते हैं तो आपको सर्टिफिकेट भी दिया जाएगा इन कोलैबोरेशन विद I-XII ओनली. और इसकी डिटेल्स मैं आपके साथ शेयर करूंगी बाय द एंड ऑफ द सेशन. रजिस्ट्रेशंस आर स्टिल ओपन, यू स्टिल हैव अ चांस टू रजिस्टर योरसेल्फ बाय टुडे इवनिंग. लेकिन इससे पहले आपको हम ये बता दें कि आप किस तरीके से हमसे जुड़ सकते हैं. सो प्लीज़ टेक डाउन द डिटेल्स. हमारा फ़ोन नंबर है 8800440559. And we also have a dedicated email ID for you, which of course you can watch on your screen. This is dth.isl31@ciet.nic.in. And lastly, on our YouTube handles, you can send us your questions, suggestions and feedback in the live chat box or the comment section. स्क्रीन पर आप देख सकते हैं कि हमारे साथ जुड़े हैं हमारे ISL इंटरप्रेटर्स नीतू एंड आशीष, जो टर्न बाय टर्न आपको ISL में पूरी जर्नी एक्सप्रेस करेंगे. एंड आई वेलकम बोथ ऑफ देम. नमस्कार एंड वेरी वार्म वेलकम. And now it's time for me to introduce everybody out there to two eminent personalities who have joined us for this wonderful day one session, which is going to be on understanding the basics of hearing types and degrees of hearing loss. इस सेशन में हम कुछ बहुत ही रेलेवेंट पॉइंट्स कवर करेंगे. विल ट्राई टू अंडरस्टैंड द एनाटॉमी एंड फिजियोलॉजी ऑफ ईयर. साथ ही साथ हम हियरिंग लॉस क्या होता है इसके बारे में जानेंगे डिटेल में. वी विल ऑल्सो लर्न अबाउट टाइप्स ऑफ हियरिंग लॉस, कॉमन कॉजेज एंड मच मोर. इसके बारे में ज़्यादा डिटेल्स डाइवर्ज करेंगे हमारे एक्सपर्ट्स, जिनको मैं अब आपसे इंट्रोड्यूस कराना चाहूँगी. इन द स्टूडियो आई एम जॉइंड बाय प्रोफेसर भारती कौशिक फ्रॉम CIET NCERT. मैम नमस्कार एंड वेरी वार्म वेलकम टू यू. और हमारे साथ ऑनलाइन जुड़ी हैं अनदर एक्सपर्ट ऑफ आवर्स. वी हैव विद अस डॉक्टर N.Devi. शी इज़ एसोसिएट प्रोफेसर इन ऑडियोलॉजी फ्रॉम ऑल इंडिया इंस्टीट्यूट ऑफ स्पीच एंड हियरिंग, दैट इज I-XII, Mysore, Karnataka. मैम नमस्कार एंड वेरी वार्म वेलकम टू यू टू.
Namaskar to all of you.
Ma'am, please stop sharing your screen. Yes, we need you here. Yes, so ma'am is right there, and we welcome you once again, ma'am. And we are looking forward, to learn more that why this hearing loss happens, and if it can be prevented, what are the precautionary measures that we can take, and once it is there, how it can be treated or मैनेज्ड. लेकिन उससे पहले व्यूअर्स, ये बहुत ज़रूरी है जानना कि आज जो हम ये ट्रेनिंग प्रोग्राम की शुरुआत कर रहे हैं ये क्यों कर रहे हैं, क्या इसका रेलेवेंस है और कैसे ये हेल्प करेगा उन सभी टारगेट ग्रुप्स को जिनके बारे में मैंने आपको बताया. सो आई विल रिक्वेस्ट प्रोफेसर भारती कौशिक टू एक्चुअली throw light on this wonderful initiative that we are taking up, ma'am, in collaboration with I-XII. इसका main motive क्या है? What are we looking at?
बिल्कुल. And you know, the main motive of this is, as you all know, कि hearing impairment, श्रवण बाधिता, दिव्यांग जन अधिकार का जो हमारा कानून है उसमें से 21 जो हम अक्षमताएं, दिव्यांगताएं पहचानते हैं उसमें से एक दिव्यांगता हमारा श्रवण बाधिता है, जिसमें हियरिंग इम्पेयरमेंट है, डेफनेस भी आती है। तो जब हम इसको 21 दिव्यांगताओं में से एक मानते हैं और पहचानते भी हैं उसी तरह से, तो जाहिर सी बात है स्कूल में जो टीचर्स हैं उनको भी पता होना चाहिए, जो टीचर एजुकेटर्स हैं उनको भी पता होना चाहिए। अब हम ये बहुत सरलता से मान लेते हैं कि बस इनको सुनाई तो नहीं देता है ना। जब सुनाई नहीं देता है तो इसका मतलब ये बाकी सब काम तो कर ही सकते हैं, देख करके पढ़ भी लेंगे। तो इनकी विशेष आवश्यकताएं क्या हो सकती हैं? तो टीचर्स को, पीयर्स को, यहाँ तक कि कई बार पेरेंट्स को भी ये समझने में दिक्कत होती है कि बच्चा अगर सुन नहीं पा रहा है तो उसकी भाषाई विकास, उसका लैंग्वेज डेवलपमेंट में बहुत सारे कंसर्न्स एंड इश्यूज आते हैं। आप और मैं कैसे सीखते हैं भाषा? सुनकर। आप और मैं भाषा सीखते हैं सुनकर। तभी तो जब बच्चा पैदा होता है, छोटा बच्चा घर में होता है, तो उसके आसपास उसके पेरेंट्स, उसके केयर गिवर्स या घर में जो भी एक्सटेंडेड फैमिली मेंबर्स हैं, कोई ना कोई बच्चे से बात करता ही रहता है। तुतलाती भाषा में बात करते हैं, कुछ ना कुछ पूछते रहते हैं, और बच्चा भी साउंड पर रिएक्ट करता है। मतलब वो ऐसे अपने हाव भाव देता है कि हमें लगता है कि हाँ, उसे हमारी बात समझ में आ रही है। कभी मुस्कुरा देगा, कभी रो देगा, कभी कुछ और उसके रिएक्शंस होते हैं। लेकिन वो बच्चा जो सुन ही नहीं रहा है, जो सुन ही नहीं पा रहा है, तो वो क्या करे? तो उसके लिए जब वो बहुत छोटा है तो कैसे पहचाना जाए कि उसको सुनाई नहीं देता है? कैसे पहचाना जाए और कैसे भाषा अर्जन, लैंग्वेज एक्विजिशन से रिलेटेड जो भी चैलेंजेस आते हैं उनके लिए पेरेंट्स को अगर पहले से पता लग जाए, अर्ली आइडेंटिफिकेशन, अर्ली डिटेक्शन हो जाए, तो क्या इंटरवेंशन वो अपने घर से ही कर सकते हैं। अब भाषा तो एक ऐसी चीज़ है जो आप सुन करके सीख रहे हो और आपके परिवेश में भी है। तो बजाय मौखिक भाषा के, जिसे हम सुन करके सीखते हैं, कितना ही अच्छा हो कि बच्चे के परिवेश में वो भाषा विजुअल माध्यम से उसको दी जाए। जैसे अगर आपने बोला घंटी या उसके टॉयज के बारे में बोला, तो दिखा भी दीजिए ताकि बच्चे का एसोसिएशन हो जाए, और धीरे धीरे बोलिए ताकि अगर बच्चे को आपकी लिप मूवमेंट तो दिख ही रही है ना, तो पढ़ तो नहीं पाएगा, बहुत ही छोटा बच्चा है, लेकिन एक उसे ये चीज़ समझ में आए कि आप कुछ बोल रहे हो लिप मूवमेंट से। सो ये कोर्स 5 दिन का इसीलिए भी बहुत ज़रूरी है क्योंकि एक व्यक्ति जो डेफ है, जो हियरिंग इम्पेयर्ड है, अगर आप उससे मिलते हैं कहीं मेट्रो में, कहीं आते जाते, कहीं किसी पब्लिक प्लेस पर, कहीं मे बी मॉल में, तो आप देख करके उसे नहीं पहचान सकते अनलेस उस व्यक्ति ने हियरिंग मशीन लगा रखी हो या हियरिंग एड अपनी लगा रखी हो। अगर हियरिंग एड नहीं लगाई है तो आपके सामने कोई व्यक्ति खड़ा है और उसको सुनाई नहीं देता, आप ये बिल्कुल भी पता नहीं लगा सकते हो अनलेस कि आपने 8-10 बार उससे बात करने की कोशिश की और उस व्यक्ति ने कोई रिस्पॉन्स नहीं दिया। और ऐसा उन केसेस में भी संभव है जहां आप ऑनलाइन मीटिंग्स करते हैं, तो ऑनलाइन मीटिंग्स में अगर कोई डेफ व्यक्ति है तो आप चाहे जितना मर्जी कहते रहे, हेलो सर, हेलो मैडम, क्या मेरी आवाज़ आ रही है, उनको तो आएगी ही नहीं जी, है ना, तो वो रिस्पॉन्ड नहीं करेंगे। ऐसी और भी बहुत सारी सिचुएशंस हैं जो क्लासरूम्स में हमारे सामने आती हैं। तो ये लगा कि क्यों ना टीचर्स को ये बताया जाए कि हियरिंग इम्पेयरमेंट क्या है, इसके चैलेंजेस क्या हैं, और ये कक्षाओं में, हमारे विद्यालयों में किस तरीके से मैनिफेस्ट होती है, ताकि टीचर्स ना केवल उन चुनौतियों को समझें, उन व्यवहारों को समझें जो बच्चे का अक्सर हो जाता है क्योंकि उसे हियरिंग चैलेंज है, हियरिंग इम्पेयरमेंट है, या तो हार्ड ऑफ हियरिंग होगी या डेफनेस होगी। तो ये सारे व्यवहार जब तक हमारी टीचर को समझ में नहीं आएंगे, वो इन चुनौतियों का संबोधन, इन चुनौतियों का एड्रेसल अपनी क्लासरूम्स में नहीं कर पाएंगी। सो दैट इज़ वाई दिस कोर्स इज़ quite essential for all the teachers and viewers out there. This will help them in supporting child's language development as well.
Yes, thank you so much ma'am for introducing this course to all our viewers. और मैम ने बिल्कुल सही कहा, Rights of Persons with Disabilities Act 2016 जो कि मई 2017 में इम्प्लीमेंट किया गया था, 21 डिसेबिलिटीज़ को रिकग्नाइज करता है, लिस्ट करता है, और हियरिंग इम्पेयरमेंट इज़ वन ऑफ देम। जैसे कि मैम ने कहा बहुत ज़रूरी है, क्योंकि बच्चे का जब जन्म होता है तब भी उसके चेकअप के साथ काफ़ी चीज़ें पता लग जाती हैं, नहीं तो ओवर पीरियड ऑफ टाइम भी आप आइडेंटिफाई कर सकते हैं कि बच्चे में कहीं हियरिंग लॉस तो नहीं हो रहा। तो स्टार्टिंग का पीरियड बहुत क्रूशियल है, पेरेंट्स को समझ आता है और उसका डायग्नोसिस अर्ली होता है, असेसमेंट जल्दी हो पाता है, तो सर्टिफिकेशन में कोई दिक्कत नहीं आती, और जो इंटरवेंशन स्ट्रैटेजीज़ हैं वो आप ले सकते हैं अकॉर्डिंगली, और जो बच्चा है वो एक कॉन्ट्रीब्यूटिंग मेंबर बन जाता है सोसाइटी का। व्हेन इट कम्स टू एजुकेशन, ऑफ कोर्स टीचर्स को भी चीज़ समझनी बहुत ज़रूरी है कि हार्ड ऑफ हियरिंग या हियरिंग इम्पेयरमेंट टोटल इसमें क्या डिफरेंस रहता है, क्या दोनों के कॉजेज़ हो सकते हैं, क्या डिग्रीज रहते हैं, ताकि वो अपनी जो टीचिंग लर्निंग का प्रोसेस है उसे भी कस्टमाइज़ कर सके और बच्चे की सिचुएशन को समझ सके। वी विल अंडरस्टैंड अबाउट इट मोर इन दिस जर्नी, क्योंकि आज हम बात ही करने वाले हैं बेसिक्स ऑफ हियरिंग, टाइप्स एंड डिग्रीज ऑफ हियरिंग लॉस को समझने की। So now I will come to Dr. N.Devi. Ma'am, Professor Bharti Kaushik has introduced this course and how important it is for all of us to take benefit of what we are offering, so that we can have this empathy, and especially the teachers, pre-service teachers, regular teachers can understand where the child is coming from when it comes to hearing impairment. So I want to understand from you, what would you like to tell us about the hearing loss? What is a common definition that each one of us must know? Ji.
Thank you, Ms. Harpreet. So I'm going to take you through this in terms of how do we hear and what is the basic mechanism in hearing. So before moving on directly, we will just see when do we actually start hearing. Like, it is not just after the child has been born. It's like much before, when the child is even in the womb, the child can start hearing. So to say, like, when the expected mother is in the first trimester, so the ear actually starts developing simultaneously with the other organs that has been developed. So by around 8 weeks, the ear starts developing. And it's not just the development, the child should also start hearing. So by around the second trimester, that is by around 20th week or 5 months to say, the child can start actually hearing the sounds, the internal biological sounds of the mothers, when the child is in the womb of the mother itself. So by 5 months, the child can start hearing the sounds, and the child can even start hearing the sound which has been happening outside also by the late end of the second trimester, that is around 25 to 27 week, what sounds are being happening around the child when the child is inside the womb. So when the child is ready to be delivered at around the end of the third trimester, the child can even comprehend and recognize the voices.
Okay.
So that to say that when the child is born, the child is completely able to hear the sounds that are there in the surroundings. Okay?
Right.
So let me just quickly take you to the functions of the ear.
Okay.
So we all know that it's very important for us. So what do you think? Like, can I have answers from them? Is there a possibility?
Of course, ma'am. Of course, you can direct your questions to the viewers out there, and to all the viewers, I request you to kindly give answers or just share your feedback and experiences. If there is anything in the live chat box, and please do not mark your attendance, ask relevant question. So, ma'am, if you direct this question to me, I can say the basic function of ear is to help us hear. Yeah.
Yes. Anything more?
Anything more? It's one of the senses, Professor
Yes.
Bharti.
I know I may act like a spoil sport and I may give you the desired answer. Devi ma'am, shall I?
Yes, ma'am.
Because many of our viewers may not relate what answer I am going to give about hearing. So now don't tell me afterwards that I didn't warn you. But hearing, the ear also act as an organ that balances, that provide balance.
Yes, ma'am, you are absolutely right. It also has an organ which helps us to balance, which helps us to walk straight, make us to feel in the environment. So that, I mean, that spatial orientation, it definitely helps us. There's an organ. I'll be taking you through that also. So major thing is, it's actually help us to tell there is a warning signal around you. Like if some danger is happening around, some honking sound of the bus is there from back or any vehicle, we get to know that's the main function. Okay, other than that, the secondary thing comes in terms of hearing to the music or hearing people around you.
Yeah.
And most important is only when you hear, we are able to speak.
Right.
Like our communication happens through learning to hear the sounds that are there in the environment and then respond to those sounds by through our speech. So unless your hearing is normal, you will not be able to speak, and then you will not be able to communicate further. And finally, it helps us for our education. If we are not able to hear and speak or communicate in the environment, we will not be able to go further with the in education also. Okay,
Yes.
so to see how this hearing actually happens, I want to take you all to the structure of the ear.
Right.
Okay, so we all think that we have seen only this, right, as a ear. Can you see the pointer, like the external ear, what is shown here? We all think,
Yes.
okay, that's all is our ear, but it is not as simple as it is. It is just one part of our ear. As I have divided here, we have outer ear, inner ear, and then middle ear, and then the inner ear. So here it's just the external ear, whatever we are seeing, it just funnels the sound into the ear canal. All the other functions, whatever we listed, like what the ear actually does, all happens within the structure which is not visible. Okay, so any problem that happens in our outer ear, which is not visible, or the middle ear, or the inner ear, or the auditory nerve that reaches to the brain, then we will not be able to hear the sound. Okay, so I think, ma'am, Bharti ma'am, you just told about the balance organ that is also here, which is nothing but your vestibular or semicircular canals, which helps for us to balance also. Okay, so this is one of the important thing what we have to understand. It's not just by the look of the ear which we see outside it helps us for hearing. It's the other invisible part of the ear which is inside our body which helps us for hearing as well as understanding. And you can see this tube which is called as eustachian tube. This also plays a very important role, and especially for school going children. I get to this later on. Okay, I would like to take you to a video to
Okay.
show how actually we are all able to hear the sound. I just showed the anatomy, but
Right.
how the sound, whatever we are hearing, is being traveling through these parts of the ear. We'll just see that.
Sure. So what we see outside is just tip of an iceberg. There is a lot more
Yeah.
inside, right? Amazing video, I must
Yes.
say.
Yeah, thank you all for watching that. But so it's a complicated process. It's not as simple as we see from outside the
Yeah.
external area and see and then just tell it is normal. So the sound, it just acts as a collecting funnel. It just collects the ear sounds that are there in the environment, but then the middle ear and the inner ear and the auditory nerve that sends the information to the brain is what that actually makes us to hear the sound and also understand what we are hearing. So till here the auditory, till the inner ear, this part we can just hear the sound. Okay, but for us to understand what is the meaning of that, giving a meaning to that particular sound happens from the auditory nerve to the brain, that stimuli that reaches. So for some individual, they might all these structures may be normal, but the auditory nerve might not be normal, which because of which they will not be able to understand. They'll be able to hear the sound, but however they'll not be able to understand the sound. So there are so many complex disorders that happens within these structures, which we are going to deal in much more detail. So this is just the basics of hearing what I've just told you. So I
Right, ma'am.
hope it's clear for you.
Yes, absolutely, ma'am. Thank you for making us understand the anatomy and physiology of the ear and helping us understand the basic functions and how they are performed inside the ear. You're absolutely right that it's a very complex structure, and any damage to the ear can lead to partial hearing impairment or a permanent deafness. But reasons differ. I have seen and heard that sometimes it's genetic, sometimes it's an acquired one due to some accident. As we all know that since it's a disability, it cannot be treated completely, but yes, this is a condition can be managed, and for right intervention we need to understand how it happened. We need to go to the causes. So Dr. Devi, let's try to understand that what kind of hearing loss exist and how do they occur.
Yeah, as I've told you about the anatomy, I'll just differentiate you into the different types, like depending upon where the problem occurs and how, depending on the problem, the type also varies. Okay, so we have three different types of hearing loss depending upon whether the problem that occurs in the external ear, okay, or in the middle ear, or in the inner ear, or if it happens on the auditory nerve. So
Okay.
if any of these places have, the type of the hearing loss also vary. Okay, so to tell you in brief, like if anything that happens, if there is any problem in the external ear, okay, we say that as a conductive hearing loss, and usually these conductive hearing loss are treatable either through medication or through surgery with the help of a otolaryngologist. Okay, or if there is any damage that happens in the inner ear where the cochlear and our balancing system is there, the vestibular system is there. Okay, usually they are not treatable through the medications or surgery. So we have the other management options, which I will be telling you in detail. So those comes under the type called sensory neural hearing loss.
Right, ma'am. Ma'am,
Sometimes there might be individual
yeah.
who will have both the problems. They will have external problems also. They will have problems in the internal ear also, that we called as mixed hearing loss. Again, depending upon where the problem where the problem is there, the extent of the problem, we tell it as a mixed hearing loss. And this is definitely very important for the teachers, because unless they know whether it's a conductive hearing loss or a sensorineural hearing loss, they will not be able to guide the child in a classroom setup. They will not be able to tell whether you have to go for a medical treatment or they have to use some aids and appliances for them to manage in the class. So this is very important for the teachers as well.
Yeah, you're right, ma'am. I've heard, ma'am, that in order to get the certification for any disability, one must have any kind of loss. I mean, the percentage should be at least 40%. So there are certain degrees. So I want to understand from you that how is the degree of hearing loss classified, and what does it mean in daily life for those who are having it and for the people around?
Yes, ma'am. For a child or a person to be diagnosed with the hearing loss, we actually look into two aspects. One is the degree of hearing loss, and then the type of hearing loss. So both has to match. So when we tell about a degree of hearing loss, uh, we have different classification. Like this, we measure it in terms of audiogram, where we use an audiometer equipment to measure this audiogram, and we present a particular type of signal. It's a pure tone, okay, across different frequencies. Like we present 250 hertz, 500 hertz, 1 kilohertz, 4 kilohertz, 8 kilohertz, like from low frequency to high frequency. You saw the anatomy, right? In one of the part, they told like we can hear different frequencies of the signal differently. So to measure the different part of that ear component, we also present different signals with different frequencies and appropriate intensity, and then plot this graph. So depending upon the graph that we obtain, we classify them into different degrees of hearing loss. To make it more clear, if you see this white portion, what is there, that is all normal hearing, like what when we undergo any testing ourselves. So our thresholds will all come under this. That means anything that is lesser than this signal also we are able to hear the softer sounds. But when we tell mild hearing loss, moderate hearing loss, severe hearing loss, and profound hearing loss, the sounds whichever are below this, they are not able to hear. So when you say mild hearing loss, around like till 40 dB of the signal, those sounds they can hear. Whereas whichever is higher than this, whichever is higher than this, they will be able to hear. Whichever is lower than this, they can't hear. And when you say moderate hearing loss, anything that is below this, they will not be able to hear, and only when it is little higher intensity of sound, they can hear. And severe and profound also the same thing. So when you say profound hearing loss, 100 and 110, which is really very high intensity sound. It's like just a firecracker burst or a bomb burst. So those sounds are really not tolerable for a normal hearing individual. So only that much of intensity of the signal can be heard by a child who has severe to profound hearing loss. So again, this will help us to understand how this child will be able to perceive the sound in a classroom. So if a teacher is speaking at an intensity of 40 to 45 dB, and if a child has severe hearing loss, then the child is absolutely not hearing any sound what the teacher is speaking. Okay. So it's very important for a teacher to look back into the audiogram to see what is this child's degree of hearing loss. Whether what I am teaching in the class, is the child able to hear as other child are hearing. So any teacher who comes across a child with hearing loss, please get to see the audiogram and try to understand whether the child, whatever you are speaking in the class, is audible for the child or not. Okay, so this is how we classify, and when we see the audibility they hear, and as and when the degree of hearing loss goes higher and higher, the clarity of speech in terms of understanding for the child, and especially when you say in a school setup, there will be a lot of noise around. There will be some class will have a PT class, and some other class, the teacher, if they are not there, they might start making noises, or some people will be going in around the corridors. So there will be noise definitely outside. In the presence of the noise, it makes it much more difficult for a child to understand what's there in the environment or what the teacher is speaking in the class. Okay. Right. So getting to know the type of hearing loss as well as the degree of hearing loss through the audiological evaluation, the child is gone already, is very important for anybody who is dealing with a child with hearing impairment.
Right, ma'am. And that's the job of an audiologist, to check the degree of hearing loss, because generally what happens when any such thing is identified, people think that they must go to pediatricians, but they will only direct you to audiologists because they are the correct people who do the diagnosis and tell you the degree. And ma'am, any condition has its signs and symptoms that we must identify in time to get the right treatment or the right intervention. When it comes to hearing loss, what are the signs and symptoms that parents at home should look out for, and in schools, teacher should be really vigilant about?
Yes, this is very important, because identifying a child with hearing impairment is very difficult.
Yeah.
So we have some of the ways in which we can identify the hearing loss. So if you just like through the physical appearance, or we have some high risk registers, like we have some indicators. I'll be showing you that for hearing loss, as well as the developmental milestone of a child, to see whether they are deviant from a normal individual or not. So to see the structural anomalies, or I told you, like by seeing the structure of the ear, we can try to identify. So this is a normal ear. If you see the other pictures here, okay, they don't look normal, right? So we can say this is an underdeveloped ear, or this is a small ear.
Yeah.
This the canal itself, it's like very narrow. It's not open properly, and here there is no opening of the ear canal itself. And if you see this picture, there is no ear at all. There is no opening of the ear canal also, or there is no ear at all. And this is like big ear, and there are so many deformities that are there in the external ear. Okay, so these are some more examples. Like we can just get to see by the structure of the external ear whether the child has any problem or not. But this is just by seeing the external ear abnormality. Okay, this is one way of identifying. Okay, if you see that, okay, this child's ear looks something different, I think this child might have a hearing problem. This is just basic thing one can check in for. But looking into this ear, do you feel this child has a hearing loss? Because the external ear absolutely looks normal, right? So do you think this child will have a hearing loss, or the child will not have a hearing loss?
I think no hearing loss because ear looks normal from the outside.
Yes, I
Because I
want
said
to.
one of the ways to see the ear abnormalities. So outside, when you see absolutely normal, so I don't expect this child to have a hearing loss, but that
Yeah.
is not the correct thing.
Yeah,
Yes.
Dr. Devi,
Okay,
Professor
both of
Bharti
the
wants to ask you something before you proceed. Yes, ma'am.
Devi ma'am, this is like exactly what my question would have been after looking at lots of pictures of the deformities or the structural changes that we can see in the ears of a child or maybe person, which might be an indicator of a hearing impairment. But now you are showing a picture whereas the ear looks absolutely okay to a layman, but there might
yes.
be chances that the child may have some hearing impairment. How many, what are the chances? Because I have seen many people who have absolutely normal hearing structure from the outside, but still they are not able to hear anything.
Yes, ma'am. That is why I brought up this thing, because most of the time it is a hidden disability.
Yes.
If you see the hearing loss, if the external ear is normal, we cannot tell the child or a person will have a normal hearing, because it is invisible. As I told you, discussed with you the different parts of the ear, the external ear, what we saw absolutely is looking normal. But there could be problem with either in the middle ear or in the inner ear, which
Yes.
is not seen outside. Okay, in such condition, the child might still have a hearing problem. So it's very important for a person to check into the other signs and symptoms, not just only the external ear deformity to tell the child has a hearing problem or not. So
Yes.
we have other indicators also to get to know whether this child might suspected for a hearing loss or not, because we can't get to see the problems which is happening inside our ear, the other
Yeah.
parts of the ear. Okay, that's what it is very important. Okay.
True. Absolutely true.
So to be much more specific, I'll want to give you some clues on the other. It's not just external ear deformity. We have other clues also to check whether the child can have a hearing problem. You would have seen some of them getting ear pus like this from the ear. There are some watery discharge that is coming, or pus is coming, or some wax or some kind of growth that is being seen inside the canal. So these are also not a healthy ear. So it could be like the child would have had a ear pain, or there is a other problem that is happening in the middle ear or the ear canal or the tympanic membrane, the other parts, because of which this particular problem has come. We should not ignore these, because these signs and symptoms also lead to a child with developmental delays. In terms of more specifically, the speech and language development might be delayed even if this condition occurs, which might end up having problems with the education. Okay, so if even a wax is very important for a child to be cleared off, because wax getting accumulated in the ear canal will not allow the sound to enter into the ear. See, as you can see here, the hard wax is getting accumulated. The sound passes through this. When there is some blockage here, you can it will not allow the sound to pass into the tympanic membrane for it to do the other process. So even a wax, though it will not have a hearing loss as such, but it will not, when something is being told to them very softly, when it is like a minimal sound is coming, like around less than 35 dB of signal, which we are able to hear, those sounds will not be heard by a child who has even a wax. So even this has to be taken care. One more specific thing, what I told you, this is very common in school going children, what we have observed. I think most of us would have seen children having cold and cough. We just think, okay, this child, the climate has changed, it's rainy, or any other reason it could be, the child has got cold and cough. But it makes a great impact for a child, school going child, especially in terms of the education, because we have a tube which is called as eustachian tube, which connects to our middle ear and the nose. Okay, so when any cold or cough or anything that happens, immediately the eustachian tube which is there, that also get infection, and that infection gets passed on to our middle ear. So when there is a middle ear infection consistently, then the child, again, whatever sound is being coming inside to the from the external ear, will not, the middle ear infection will not allow it to pass to a inner ear, because of which the child will not be able to hear the sounds clearly. It's not that the child can't hear even a loud sound, but the intensity of the sound what a school teacher will speak in the classroom will not be heard if the child has frequent cold and cough. So immediately, even for those who have recurrent cold and cough problems, they also have to be referred to an audiologist to get their ear checked very frequently. Okay, why this happens is there are so much of literature report that says that a child who has this middle ear infection is has a lot of understanding problem in the class. The child is not able to speak clearly or speak less, because the child is not hearing it. The child tries to reduce the expressive language, okay, and always asks for repetition in the classroom, or the child doesn't go and play with others because the child is not hearing or understanding what the peer is saying. When they are playing, the child says something else, the other child speaks something else, so there is miscommunication, misinterpretation of the signal. So they try to avoid going and playing with them, and finally it affects their learning performance in the classroom. They become weak, means poor performance in the class. So even if the child has a ear pain, infection, or even a cold and cough, it should not be ignored, because it's much more difficult than just having a external ear or a middle ear problem, or the inner ear problem, because this directly affects our processing problem. So we call that as processing disorder. So for this purpose, we have prepared a checklist. Like I told you about the external ear anomalies, and then how the signs and symptoms are there. So from I-XII, we have prepared a specific screening checklist on the ear and hearing disorder among the school children, which we have around 20 questions. So if any of the indicators for ear disorder or the hearing disorder, even for one question, if it is yes, definitely the child has to undergo a complete hearing screening at the earliest. Okay. Uh, as I told you, even just a cold and cough should not be ignored, because it affects not only the middle ear, even the tympanic membrane, and finally the child ends up in a disorder called as auditory processing disorder. This is much severe than just having a inner ear problem, because as I told you, till our inner ear we can hear the sound. Okay, but the auditory nerve is the one which helps us to make it more meaningful, the sound is. So when a child has frequent history of cold and cough and frequent middle ear infections and recurrence in the infection, the child will end up in having an auditory processing disorder, where the child hears the stimuli or the sound, but the child actually is not able to understand the meaning of it, because it's not passing the stimuli to the brain. It's not able to pass on, and especially this is much more difficult for the child when there is any noise in the surrounding. And definitely school, we can't tell it is a silent zone. It's always a classroom with some sort of other sound that is there in the environment, where this child finds it very difficult.
Yes, absolutely.
So
Devi ma'am, there is a minor concern here. Though you are very nicely explaining all this connection between the common cold and cough and the possible maybe danger of having this auditory processing infections in the middle ear and then leading to the processing disorders kind of a thing. But tell me one thing, as a parent or as a regular teacher also, what is the frequency that I should be looking for in a child who is attending my class, or even in my own child at home, that I should go to the audiologist? What are those telltale frequencies and symptoms that are an indicator for me to reach an audiologist?
Yes, ma'am. For that also we have developed a identification checklist kind, which are the child who has maybe possible processing disorder. And when you say cold and cough, if within a 3 month duration, if the child at least has twice the cold
Okay.
and cough, then and within a period of 6 months, if the child has got at least thrice the ear infection as such, the child has got ear playing or blockage of the ear, the child is not able to hear soft sounds. Most of the common symptom will be the blockage of the ear
Okay.
and the pain. So if within the past 6 months, if the child has got at least 2 to 3 times these symptoms, definitely the child has to go and meet the audiologist.
Okay.
Other than the cold and cough, like the other symptoms is what that I want to tell you. Like the child doesn't understand the instruction in the class. Like the teacher would have told something, the child may not have understood. The child will ask for frequent repetition, or the child does not pay attention because the child is not hearing. Most of the time, the child will be looking outside through the peeping through the window or through the door, watching outside, distracted very quickly. Or when the classmates are talking, the child will not interfere, means be a part of the class peer group also. So the child has been asked something, the child will say something else, or like the child doesn't respond to the question. So these are some of the indicators where we can tell that this child might have a problem. Like any of these one also, if the teacher or the parent observes, immediately they have to refer the child for detailed audiological evaluation.
Absolutely.
It could be hearing loss or it could be processing problem. Anything could be the problem.
G.
Right.
And
Most of the time, the processing problem is one which is ignored, because the child will hear the sound. Like as soon as you call, the child will attend to it, but the child will not understand the meaning of it.
Exactly.
So it looks like the child is not attending the class. So
Bilkul.
actually, it's not the problem with the child; it's problem with the processing of the child,
Yes.
which requires much more attention than what we think.
Bilkul. And Dr. Devi, after listening to you, this is a solace to people like me who may not be rushing to the audiologist even if the child is having once or twice a year the common cold and cough, because that is not the cause of concern. That is why I wanted to know the frequency. And whatever symptoms that you have shared with us about the auditory processing disorder, they somehow overlap with other disability conditions, जिसमें SLD भी है, स्पेसिफिक लर्निंग डिसेबिलिटीज़ भी हैं. सो बहुत टीचर्स के लिए बहुत एक केस हो जाता है सेंसिटिव सा, जहाँ पर उन्हें they have to take care of many of the behavioral symptoms and manifestations. That is why we are focusing so much on the screening. You have also developed screening checklist. NCERT has also developed a screening checklist. So the recommendation would be that teachers need to use the screening checklist for specific disabilities, as well as the pressure screening checklist that take care of all the 21 disability conditions. So it's a very significant information that you are sharing with us.
Yes.
Thank you.
There is always an overlap of one symptom with the other symptom. So once when they are referred to a professional, they will do a differential diagnosis, and then we can rule out what is the specific problem or the cause, and then we can give the management accordingly.
Absolutely.
Though there are overlap of the signs and symptoms, like when the professional handles it, they'll be able to diagnose and then give a proper management. So the teachers have to, like, if as soon as when they feel that the child is performing poor in the class, the child is not attentive, something is different from the other, immediately they have to refer to the professionals.
Yes, and we do have ENT specialists, means there is a connection between ear, nose and throat. So once the cold and cough problem is there, you must be aware of the fact that it can affect or impact the ears also. And now let's talk about the causes of hearing loss or hearing impairment, both in children and in adults. Sometimes I know that it can be a genetic problem, it can be lack in prenatal care, it can be a geriatric problem as well. So Dr. Devi, kindly elaborate what are common causes so that we can take precautionary measures if possible.
Yeah, till now, whatever so I was telling is all in terms of the parts of the year and like at different part of the year, what problem can occur. But beyond that, we also classify the causes of hearing loss depending upon the nature. In terms like whether if there were any problem before the like as I told you, the child starts hearing by the ear starts developing by 8 weeks. And then by around 20th week, the child can start hearing the sound which are there, and then so it happens before the child is being born. So
Yeah.
even if there are any problem that occurs during the pregnancy time of the mother, like if there is any infection during the pregnancy, like rubella or syphilis, or if there is any genetic causes in the family, or if it's a consanguineous marriage, or if the mother has taken any medication, like if that has an autotoxicity. So all these can have an effect on the child before the child is being born, and that could lead into, most of the time it leads to into the problem with the inner ear. Because if this happens especially between the first trimester and the second trimester, where the development of the ear happens, it directly has an impact on that, and the development doesn't happen. So even once when the child is being born, we will not be able to rectify that causes. So it should be cautious that during this developmental stage, the first and second trimester, they have to be very careful. The expected mothers have to be very careful so that they don't encounter any of these issues. And it's not just before the birth, even at the time of birth also, there are some causes because of which the child can have a problem, like if the child is premature,
Yeah.
the child was born like around 32 weeks, 31 weeks, still the development still is happening, the neuronal connections are still happening. So or if there is any complications in the birth, like lack of oxygen, or any jaundice was there, or there was any trauma, head injury during the delivery time, or any other anomalies to the other parts of the body, so that can also lead to some of the causes with related to the hearing loss. And it's not always like all these causes, what I told you is before the birth or at the birth. This is very important. What I'm telling is after the birth, postnatal causes, which most of us are missing out during the child that is being developing during the educational period. Like there might be some cases where the child had got high fever, meningitis, where the child has got admitted, was in ICU for or for 1 or 3 to 4 days, especially this meningitis and measles or mumps. All these also can induce hearing impairment in a child. And or any other medication, the child might have some other infection, or some like kidney problems or heart problems. The child might be on a continuous medication. Those medications can also have an effect on hearing, which is like over the development that it happens very slowly. So we will not be able to identify whether this child is having a hearing loss or not, because the child's speech will also be developing simultaneously. The child is able to acquire some vocabulary, but not to that of the other normal kid.
Yeah.
So these are some of the high risk factors which we should be very careful. If the child is not performing well in the class, then or the parent is suspecting the child is not attending to them, immediately they should be aware of these things. They should look into these factors to check whether the child will have any other problems related to hearing,
Right.
or the speech and language development is getting delayed because of the hearing that is getting delayed, is what we have to get the parents and the teachers to know at this time.
Yes.
And yeah.
So
Sorry, just a minor question or concern. डॉक्टर
देवी।
मैम, डॉक्टर देवी ये बताइए कि will it be possible for us to find out the possibility of child's hearing impairment before birth? Will it be possible for the medical science to find out?
Yes, ma'am. There are facilities for us to actually check whether the child is going to hear or not.
Okay.
But however, we have to wait till the end of 5th month.
Okay.
That is what I told you, 20th week.
20th
because the ear completely gets developed till 20th week, and then the child starts hearing only after 20th week. That is around 5 months. So 5 months to 9 months is very crucial. So if we are able to detect, we'll be able to only detect it at those time. And then in case if the child has any problem, if we suspect the child is not responding to the stimuli what we are giving, but we still have to wait for the child to be born.
Yes.
Okay.
Yes.
So telling that to the parents before the child has been born, it gives a lot of psychological and stress to the
Yes.
family as well as to the expected mother.
Yes.
So though we have test procedure to identify, but still it is a bit of confidential, that because it should not affect the mother in any way
Ji.
psychologically.
Ji.
Right.
True.
So
So
how
this way
early?
we have to wait till the child has been born.
Yes.
Right. So how early can hearing loss be identified in children once the child is born?
Yes, ma'am. That is what, though we get to know the child can hear, we can identify the child as soon as the child is being born. The day the child is born,
Okay.
we have various tests to check, and then we will be able to identify whether this child is having a hearing loss or not. So we also have a golden rule, like 136 guidelines that has been followed, and we are also following this to be implemented through our national programs, that is NPPCD programs. Like we have to get the child screened for any hearing related issues, high risk register, before 1 month of age. Though we can check the child as soon as the child has been born, we can check, but still we have to do the other screening test also to confirm. So to confirm the diagnosis, yes, this child is definitely having a hearing loss, we can take around 3 months time. That is to tell, yes, this child has severe degree of hearing loss with sensorineural type, or this child has moderate to moderately severe. So to come to that diagnosis, particular diagnosis with the degree of hearing loss and with the type of hearing loss, by 3 months age of the child, we should complete it. And we should start intervention with the child, that is in terms of providing them therapy, the stimulation, because by this time the child starts developing the speech and language, like the child will start babbling, like papa 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 coo, like that the child will start cooing and babbling. So before that starts developing, we should also start with the intervention program of providing them with the appropriate hearing aid or cochlear implantation, and then start with the stimulation. Okay, and actually, World Health Organization is trying to make it much more shorter. Instead of 136, they are also trying to get it to shorter. That is 123 rule. Instead of 136, we should not wait till 6 months of age for them to be fitted with the any aids and appliances. By 3 months, we should be able to start providing with them hearing aid. So for that to happen, all the hospitals should have a facility to screen the child born with hearing impairment. So once when that is achieved, before the child is being discharged from the hospital after the delivery, the hearing screening should be mandated. So if that happens, we'll be able to meet this rule of achieving 1, 2, 3. But still, we are getting to try to do that. At least by 6 months, we should start with the intervention program. So why we say as early as as early the child has to be sent for intervention is, the child's development happens very quickly during the initial 2 to 3 years of age. So the brain development, the neural plasticity, the firing of the brain connections are at the highest. So whatever input you give, the child will be able to pick it up. Like if you teach them even 2 languages, 3 languages, 4 languages, the child will be able to grasp it at the fast, compared to those who want to learn it later on. So the early we identify them, diagnose them, provide them with appropriate aids and appliances, we can send before they go to a school. We wanted it to be completed. So they have to go to a normal school with a normal child. So we want to get that inclusion. Like they should not be delayed. Like if a normal child is going to second standard, we should not have this child in LKG or pre-KG. We wanted this child with hearing problem also to be in second standard only.
Yeah.
So if we have to achieve that into an inclusive setup, we have to identify them at an early stage and rehabilitate them appropriate aids and appliances, and then start giving them the therapeutic process
Right.
for them to reach to a normal peer group.
Okay. Dr. Devi, we are left with very few minutes, like 5 to 6 more minutes. So, very quickly, I would like to ask you some more important questions. I want to understand that is hearing loss permanent, or it can be reversed or treated through advanced medical technologies? And also, what are the management options available? Because we know that it's a condition that can only be managed forever. So, please elaborate on this.
Yes, ma'am. Actually, it's not always permanent. There are certain conditions, as I told you at the beginning itself, depending upon
Yeah.
where the problem happens, whether it's in the external ear or in the middle ear. It is usually temporary. If it is in the external ear through medication or surgery, we can rectify the hearing disorder. Like even if the cold and cough is there, if the child is continuously taking medication, the child has got the ear infection. Treated through medications, then it is reversible. It's not permanent, it is temporary. But there are certain conditions, if the inner ear or the auditory nerve is affected, we cannot reverse it. Most of the time, those get into the permanent issues.
Okay.
And we have some of the test, like as a professionals, we we test them through audiometers, diagnostic test procedures, like behavioral observation audiometry, visual reinforcement. We always do a test battery to find out what is the exact cause, which part of the ear is being affected. So we get to the conclusion and then treat them accordingly. So these are some of the test procedure. And moving to the management
Yeah.
part, as I told you, if it is our external ear problem or the middle ear problem, usually our otolaryngologist take care by providing them with appropriate medication or through the surgical procedure. It can be rectified or reversed. But in non-treatable permanent hearing loss, we have two options, that is fitting them with the appropriate hearing aids, which is an amplification device. As you can see in the picture, we have variety of hearing devices. This is called as behind the ear hearing aid. This is called as receiver in the ear hearing aid. This is called as completely in the canal hearing aid, and this is ITC hearing aid in the ear hearing, in the canal hearing.
Right.
So different types of hearing aids are available, which can be fitted depending upon the degree of hearing loss and type of hearing loss. We cannot just select any one model and then give it to them.
Right.
We have to test with the hearing aid whether they are benefiting it with them or not. Is it appropriately suitable for their degree of hearing loss? We have to check for that as an audiologist and then prescribe them. In case if the child is not benefiting with the hearing aid, whose degree of hearing loss is much higher, then we provide them with the surgical option with
Okay.
fitting it. As you can see here, the child is wearing a cochlear implant. Like some parts are externally fitted, some part are internally fitted, and then we provide these kind of options also for them to learn the speech and language much better.
Right.
But after this is very important, the oral rehabilitation. Okay, because just fitting them with the hearing aid is like giving them the medicines, and we don't see whether the child is actually taken the medicines or not.
Okay.
So this oral rehabilitation is like we have to. The child is, after fitting a device, the child is just able to hear the sound. The child still doesn't know the meaning of the sounds. So through the therapy, speech and language therapy or the listening therapy, what we provide, we make the child to understand what the sound the child is hearing through the hearing devices.
Right.
Okay, so this is very important.
Right.
Provide just fitting will not be enough. They have to undergo a continuous therapeutic process.
Absolutely, we need to know whether it's working or not, and for that we need to continuously go for the speech therapy and see if there's any progress. Now, ma'am, I have reached to the last question, and I think it's very important because these days what we are seeing, that everybody is hooked on to their headphones. They're using it sometimes for entertainment purposes, sometimes it is essential for work purposes, but again it can lead to hearing loss in the long run. This is the one disability that can be acquired, and with age things do get worse. So how we can prevent ourselves, like general public, prevent itself from this hearing loss?
Actually speaking, most of the causes that are related to hearing disability are preventable.
Okay.
Except for the prenatal causes, that also with care to the mother, expected mother, like most of the causes we can prevent them. Okay, so I'll just give you some of the tips, like which can be prevented means avoiding the acquired condition. Like I think most of us have the habit of cleaning the ears with the earbuds. Like that itself like can cause irritation to the ear canal or the eardrum. Like they don't know the size of the ear canal, so they try to put the earbuds into the ear canal and then they rupture the tympanic membrane. Then that will lead into a hearing loss which requires a surgery, and there might be loss which is permanent also that has been left. Or sometimes still people have habit of pouring oil into the ears just because they felt like they have irritation or they have a blockage in the ear. They didn't understand that it's because of the cold and cough that they are having a block in the ear or a ear pain, or it could be the any other fungal or bacterial infection. They still pour oil into the ear. Already our ear has a oily structure, which
Yes.
we prevent any of the problems. So pouring more gets into more problem. Or like kids when they are in the school or when they are playing with their neighbors, they slap on the ears. Or even
Yeah.
some parents have the habit of slapping them on the ears. So they don't understand the how the eardrum can rupture because of the pressure that happens with the slap. So and as I told you already, the persistent ear discharge or the ear pain because of the cold and cough, the infection that happens in the middle ear. So all these can be prevented. And to the important thing, what you had already brought to the notice of the participants today, listening to loud sounds. This has become a habit to each and every kid as well as an individual, from children to the geriatrics. They enjoy listening to the sounds from their mobile or any other devices through the
Yeah.
headphones or the earpods. Even parents are gifting earpods to the kids. Okay, there's no
Right.
harm on gifting it, but along with that, they should tell them the rules also how to follow. So they keep having it in the higher intensity, higher loudness.
Absolutely.
Even neighbors who are like 5 feet away from them also can hear the music what the child is hearing
Yeah.
through the earpod or earphones. So they don't hear actually who's speaking from, who's calling or who's talking to them. So there are like the continuous usage of the headphones or the earpods itself can irritate the ear canal, which can get irritation, fungal infection to the ear canal because there is no external ear that is passing into it.
Yes.
So
You're
it,
right.
it becomes more moist.
We need
Moisture
to,
is there.
we, yeah, of course, Dr. Devi, we need to take care of these tips that you have shared with us, and no matter how frivolous it seems, but in the long run, it's going to give you a grave problem. So thank you so much for your time and for your valuable inputs. Thank you so much for taking day one session on understanding the basics of hearing, types and degree of hearing loss. You have set the foundation for the rest of the days. I'm sure teachers are going to benefit from the discussion that took place today. Thank you so much, Professor Devi. Thank you. Thank you.
Thank you all for your
Yeah.
listening.
And thank you so much, Professor Bharti, for
Thank
being
you.
with us and for asking such pertinent questions. They were really valuable and beneficial. And now, viewers, it's time for me to wrap up day one's session, which took place under the umbrella theme of including children with hearing impairment in the mainstream school education. And now, very quickly, I have to show you the website also, because you must know from where you can attempt the assessment. So let's go to the website, and as you can see, you just need to log on to our CIET web page, and here under the activities section, go to live inclusive classrooms, and there you can see these activities happening. You scroll down and we have this ongoing activity including children with hearing impairment in the mainstream school education. It has started today from 22nd of September. It will continue till 26th. And when you will click on the same, you will get this complete write-up on why we are conducting this training session, who all are target participants, and objectives of the training program, along with the program schedule. Whatever programs or the live sessions we are airing, we will upload them here as well. So in case you have missed out on any live session, do not worry, you can go to the uploaded one here on this link and you can watch it again. I told you that registrations are open till evening today, so please make use of the time that is left. You can participate by registering yourself, use this link or scan the QR code. Second step is to watch all the live training sessions very carefully that are taking place from 22nd to 26th, and they are available on these platforms. The third step is certainly to attempt the quiz that will get open on 26th September, last day of the training session. A link will be placed here once the quiz gets open, and I told you in the beginning, if you score more than 70%, you will be granted a certificate. These are the guidelines, and you can always share your queries and your feedback with us through the feedback link or on the email ID dth.isl31@ciet.nic.in. So with this, I'm wrapping up the training session over here, and let's take a quick look at the schedule, what's all coming ahead. So in a short while from now, you can watch a session of ours on Urdu at 2 p.m. and rest of the programs you can watch on our various handles. With this, it's me, Harpreet Kaur, taking leave of you, and will join you soon. Take care. Namaskar.